Hello, my name is Karen Emmons, and I'm the faculty lead for the Harvard Catalyst Community Engagement Program and a professor at the Harvard T.H. Chan School of Public Health. It's my pleasure to host this week's Voices from the Community. The Harvard Catalyst Community Engagement Program seeks to increase the pace of adoption of evidence-based strategies into community health practice and policy. We bring together community partners to identify community needs and then to identify evidence-based strategies for addressing those and look for ways that we can bring our resources and our skills together to try to improve community health and health equity. Our major focus is around community translation and trying to develop the next generation of leaders who are skilled and talented in the area of community engaged research. So it's my pleasure today to have the opportunity to talk with you about one of our key activities, which is providing our students with the opportunity to partner with communities on key priorities to learn about community engaged research firsthand. Our hope is that our community partners will benefit from our spectacular students and other support that's available from the program. Today, I'm joined by HMS student Morgan Sedev, along with Ann Vinnick and Elizabeth Gonzalez Suarez from the Community Builders. I'm going to ask each of our guests to introduce themselves and tell us about their involvement in this collaboration. And I'm going to start with Morgan and ask her to tell us a little bit about the project and why it was of particular interest to her. Morgan?
Hi, thank you so much for having me today. My name is Morgan. I'm a fourth-year medical student at Harvard Medical School, and I was initially drawn to the Catalyst project because of my past interest in public health and community development. I spent a lot of time as an undergraduate working in community capacity building, and as I go forward in my clinical training, I really wanted to continue studying in the community and helping the community in terms of public health initiatives and health outreach, both from the community building aspect and from the public health aspect. And so I was partnered with the Community Builders and more specifically at their Amory Street building, a new site for the Community Builders over the past several years. And at Amory Street, the initial goal of our project had been twofold: to first help facilitate the Community Builders' understanding of the health needs of the tenants at the Amory Street building, and second, to develop and implement an intervention at that site. And initially we had thought that this might be in the form of a health fair or by developing a plan for the soon to be renovated first floor common space. However, my project started a couple of months prior to the pandemic and our plan quickly changed. So myself, the Community Builders, and the leadership with Ann and Elizabeth, as well as the tenants and leadership on site at the building, we had to quickly adapt. And so the project really turned into a virtual and remote opportunity for me to engage with the residents at the Amory Street building, helping the Community Builders collect their community life questionnaires over the phone, and doing wellness checks during the pandemic for their tenants. And as a result of that, I'm going to help analyze the data from those surveys and questionnaires, and then translate it into a proposal for future students to use in the Catalyst program for potential interventions at the Amory Street building.
Fantastic, Morgan. Thank you so much. Elizabeth, can you tell us a little bit about the Community Builders and why it was interested in working with us on this project?
Absolutely. Thank you. So again, Elizabeth Gonzalez Suarez. I'm the Vice President of Community Life for the Community Builders. I will use TCB for short, and we are a nonprofit housing organization. We are an active real estate developer, owner, and manager of over 13,000 homes across 3 regions: the Northeast, Midwest, and Mid-Atlantic. And we serve households and neighborhoods that reflect the diversity of America, including families, seniors, formerly homeless, and adults with disabilities. And our mission is to build and sustain strong communities where all people can thrive. And we envision a world with vibrant, safe, and inclusive neighborhood in which all people live in healthy homes with equitable access to resources and opportunities to pursue their dreams. So this collaboration as the Catalyst Community Advisory Board member, I'm always looking for opportunities to engage students with the work that we do. I think that EHMS or Harvard School of Public Health students are perfect for housing, the type of work we do, the type of, we are very committed, especially for Morgan, engaging in this senior building was very important because we have 2 objectives where we thought that Morgan's work in data collection, of course, we thought about doing surveys and focus groups. COVID-19 shifted that a little bit, but the important thing is we have two very important objectives in our housing sites. One is we want 90% of our residents to have health routine checkups with their primary care provider in a year, every year. And then we want our seniors, 80% of our seniors who need support with ADLs, activity of daily living, and who need who have a chronic condition and need to receive support, that those supports, those health promotion interventions are happening in the community where they live. So for us to bring Morgan was to see, okay, let's look at the baseline. Let's look at how our seniors, this was a new community for us in Jamaica Plain. How are we doing? And the hope, and still we will continue with that plan, is to identify best interventions, best programs, initiatives to bring those support, those opportunities to housing, to ensure that our seniors are healthy and have their annual checkups and support for chronic conditions.
That's fantastic, Elizabeth. You do such great work at Community Builders, and we're so happy to have you on our Community Advisory Board, which is a group of community leaders that really help us shape all of the activities that we do. Anne, tell us introduce yourself and tell us a little bit about your role and why this project has been important to you.
My name is Anne Vinnick. I'm the Director of Community Life for New England. I'm also a licensed social worker, and I've been working in affordable housing for about 20 years. We're thrilled to be a partner with you. A little bit about the property. It's affordable, meaning that residents pay 30% of their income towards rent. There's about 200 apartments. 75% of those are for seniors, many of whom have chronic health conditions, and 25% is for non-elderly disabled residents. Really, our vision for being a partner and working with Morgan was, to develop a site-based health promotion and prevention program and help us better understand the medical and health needs of residents, so that, more informed decisions on the type of support we can offer to promote health and wellness, and determine the partners we should be engaging with can be determined. Our resources are quite limited at the property, but through this partnership, we can really envision having the capacity to evaluate data we collect with much deeper analysis, look at qualitative data, even though, again, we weren't really able to do too much of that, and ensure that our residents are getting what they need to be healthy and stably housed.
Fantastic. So Morgan, what's been the biggest surprise for you in working on this project, maybe outside of COVID, which I think sounds like it really threw kind of a monkey wrench into the plans, as it has most things community-based these days. But outside of that, what's been the biggest surprise for you?
Yeah, definitely. Outside of COVID, the biggest surprise with this project has been really how quickly the seniors and the residents at Amory Street were able to develop connections with myself and other community builders, workers, whether it was the community life coordinators or other people that were helping with these wellness checks that happened during the pandemic. I recall being a little hesitant at the beginning of the over the phone community life questionnaire procedures, because they were typically done in person in the resident's home. And this was the first time it was really done solely over the phone. I was nervous about the connection and whether or not some of the more intimate questions would be really beneficial this year, and whether or not the residents would open up. And I was shocked to find how quickly the residents were telling me their life stories and telling me about their health concerns and their health problems and the reasons why they weren't seeking care if they weren't, and why they might have trouble seeking care if they were attempting to. And so I had, the community life questionnaire should only really take 15 minutes. And a lot of the time my conversations lasted for about an hour with these residents. And so I think it was both a highlight of my week when I had the chance to do that, but also hopefully a highlight for the Residents Week, as we identified that social isolation was a really big problem within this community. And so while it provided us with a little bit more data and insight into the population, I think it gave something back to the community, and that really surprised me, and just the way those connections were fostered through this program.
I suspect part of your experience, Morgan, was because you were talking with people who are in the context of a really trusted community partner, the community builders, and that increases the willingness of people to engage. And quickly, how about any surprises you've had in this?
Well, in the context of the pandemic, there was certainly a very rapid shift in the scope of the work and the priorities. Unfortunately, we did have some residents who tested positive in those first couple of months. And, we were really fortunate that, Morgan had analyzed actually the results from the survey done prior to this project. And that told us the most prevalent health issues being social isolation, which was mentioned, food insecurity, which could put them at greater risk of more severe symptoms if they did test positive. So this information prepared us for the types of services we would need and who to target. And it was really remarkable that we were just all able to shift together and address the immediate needs of residents.
Fantastic. Elizabeth, you get the last word. Briefly, how does this project fit into your vision for community life at TCB, and what role do you see for these partnerships going forward?
Thank you, Karen. So yes, I do have I see a lot of compatibility into what we are trying to accomplish and what the School of Public Health or the medical school is trying to accomplish. And by that, I mean our deep investment in addressing social determinants of health and eliminating the health and racial inequalities. So the work that TCB does every day, investing in the social drivers of health, in housing, food insecurity, education, employment, and seeing stable and healthy housing as a platform for providing those resources and connections to opportunities that residents need to thrive, and our partnership with academia, where we can get students engaged in that work, students in helping us translate the theory, the evidence into practice, making sure that those things that we have found to be successful to improve community or population health can be brought to the community. And housing is a great opportunity for that. Furthermore, I think that housing and academia have a lot of work that they can do to, do research together, look for other opportunities to bring more resources into this type of work related to eliminating the health inequities that we are experiencing in communities of color.
Thank you so much, Elizabeth, and for the great work that you do at the Community Builders. As we close this week's Voice from the Community, we invite you to learn more about HMS Harvard Catalyst and all of our programs and resources. Thank you so much for joining us this week. Thank you very much to our panelists, and we wish you the very best holiday. Please stay safe and be well.